Hi, Dr. Ben Newman, and I study coronaviruses. All right, this is a follow up to one of the other questions. This is from Emily, this is with regard to the question about from the New York Post, where they're saying that the virus has managed to outthink us and it's managed to mutate to avoid mask wearing and hand washing. Yeah, which, as we talked about in that video, you would have to physically change the size or the chemical properties of the surface of the virus and somehow like coat it in something like Teflon, like a fluorine coated substance or something like that to maybe make it slip through a mask better. But even then, it would still be really inefficient. So yeah, so that would change. Make it mask resistant, and we talked about you'd have to have mutations in the M protein, maybe if it's even possible to make it soap resistant. And yeah, we're talking about a totally different kind of mutation, and it doesn't work either of those ways. Those are very silly. Okay, so the questions Emily has are exactly the right sort of questions, yeah, that you want to think about. And so good job, Emily. You are laying out the questions that yes, they should answer in the article, or there should be an obvious answer to, and if there's not, then somebody has not done their homework, basically. So, question one: how does Houston have the testing and tracing infrastructure to show that these cases all happened from normal public encounters where masks and hand sanitation might have been used? Whoa, yeah, nice. Because that's exactly what you would need. That's the data you would need in order to draw a conclusion like this. Or you'd have to have some kind of laboratory test where they try, and wash a surface with virus on it and then show that you can still recover this one, but you couldn't recover the old virus. And so it's different in some way. One thing about an experiment is it has to have a control in it, and you have to compare it to the test thing to the control thing. Yeah, you have to compare two different things. And if you're not doing that, it's not really an experiment. You're just doing stuff, which is okay, but, not super science. All right. Yeah, good question. Good first question. Or does the predominance of one strain suggest super spreader events? And, yeah, which, nice. Yeah, you're thinking, because just as your children inherit your DNA, yeah, the virus that comes to you has the same nucleic acid. It's RNA instead of DNA for this virus, but whatever, works the same way as the one that left the person that it was just in. So, yeah, you can only catch the virus that the last person had. Or the virus that evolved inside that last person, yeah. And the virus can only really evolve while it is inside, so that's good. And you're thinking super spreader because that's the way that one person could spread the same strain to a lot of different people. Yeah, I like that thinking. I like that thinking a lot. I think the field is moving away from the idea of super spreaders, although there are certainly documented events that could probably qualify as that. It's just there isn't a real hard line that I know of. What's the difference between a spreader and a super spreader? Is it being in a particular situation? Because you can take a person with a normal whatever case of COVID, put them in a packed, crowded bar room and watch that thing spread to everybody. Or, you can take a person with the worst case of all time, and if they're at the other end of a football field from you, you're probably not going to get infected. So, yeah. A lot of variables to account for, and I like that. That's good thinking as well. Okay, so super spreader events, or is it possible that we're talking about household transmission with extended close contact? So are people doing something different? Yeah, and that's leading... Yeah, again, these are very good questions. This is what you want to answer. Are there even enough people social distancing and wearing masks in Houston to suggest mask failure? And on the last question, you've hit our nail right on the head. Yeah. This is one of those questions where if you ask people, did you clean your room? Were you wearing your mask? They'll say, of course. Yeah, of course. Wow. You know me. Yeah. 100% mask compliant. Yeah. And then you'll scroll, you'll see their Instagram, you'll see their Facebook, and they're out having a good time on Memorial Day. No masks. Yeah. A lot of people around. doing stuff together. Yeah. So no, everybody may wear masks sometimes, but definitely not everybody is wearing masks all the time when they are outside the house. That is definitely the case. And I've only been driving around Texas, and I've got close to Houston, but not actually in Houston. But everywhere that I've been in Texas, mask wearing has been spotty. And from what I hear in other places, like New York City, for example, mask wearing is much more just like a thing that everybody does. So, yeah, right. People are not wearing masks. That's why the virus is spreading. And they're getting the strain that the last person had, which happens to be 614G in spike, not 614D. Yeah, and so that's the one. Yeah, it's a little bit better, but for the last couple of months, this has been the dominant strain in the world, and so if you catch the virus, that's the only one that's out there. That's the one that's going to get you. Yeah, and it doesn't do anything more or less than any of the other strains did. In terms of disease, it just seems to be a little bit, may just be like 5% better at spreading or surviving to the point where it can spread. So, yeah. Excellent questions, excellent scientific thinking. Very good job, Emily. Thanks very much. This has been Ask Dr.